Thank you. It's wonderful to be here. I hate this topic. This was assigned to me. I did not pick this topic. Let's see if I can figure this out. Let's see. How do we go down? Or is it this one? Okay, there we go. All right. So this is a topic that we talk about a lot. And every adult congenital heart disease conference, people talk about transition and transfer of care, and it's very important, and yet we still don't really know how to do it. And every center does it differently, which is why I hate talking about it, but we're going to do our best here. And some definitions. So transfer is easy. Kind of transfer of care is that moment where it's not the pediatrician, it's not the pediatric cardiologist anymore, it's the adult congenital heart disease doctor, it's the internal medicine doctor. Suddenly, you're not this guy's patient, you're this person's patient. Transition is a lot harder, and we have some definitions. So transition is defined as the purposeful, planned, timely transition from child and family-centered pediatric health care to patient-centered, adult-oriented health care. It's a lot of words, but kind of to sum it up, the goal of transition is to maximize lifelong functioning and potential through the provision of high-quality, developmentally appropriate healthcare services. And here's the important part, that continue uninterrupted as the individual moves from adolescence to adulthood. And that uninterrupted part, that's what we're trying to prevent. We're trying to prevent interruption of care. So, kind of my summary slide of what I think you should get out of this and what we as physicians should get out of this as well. What are the goals of transition? And that process of transitioning from pediatric care to adult care, very important, learn your disease. It's time for, instead of the kid sitting there playing on mom's phone during the entire clinic visit, to start learning what's wrong with them, the names of their operations, what medicines they're on, why they're on them, becoming your own advocate, and understanding that if you have congenital heart disease, you're going to need to see a doctor forever, that it's not over when you turn 18. Parents need to promote this. This is hard. It's hard to kind of give up some of that care for your child, but to continue to support them. Just because they turn 18 doesn't mean that you're not going to play a role in that. I'm 47. My mom still calls and makes sure I go to the doctor. So, and then understand that this is a sign of success. It's really hard. You've known the pediatric cardiologist and the pediatrician forever, and you trust them, and it's very hard to think about transitioning over to another set of providers. But this is a real sign of success. And physicians, I think, play the most important part. We need to start this transition early. You don't at 18 say, okay, well, when you come back next year, you're not coming back here. You're going to see somebody else. Start that process early in adolescence. Identify an adult congenital heart disease center and form a relationship with them so you can transfer patients early and facilitate that transfer of care. That's what we can do probably that makes the most difference is instead of saying, get on Google and figure out who's going to see you next year. Provide here's who I recommend. Here's a group of doctors that I really trust. And ideally, have the nurse come in or someone and make that appointment for them. So when you leave the clinic, you know where you're going for the next visit. And everyone needs to be patient. This is hard. Things happen differently in the pediatric world versus the adult world, and we all have to be patient with that. So we can build good relationships with each other. We're going to skip that because we talk about how common congenital heart disease is. Loss to follow-up or significant gaps in care is really, really common in adult congenital heart disease patients. And we know that if you're lost to follow-up, then you're much more likely to come in sick. You're much more likely to present needing something done emergently. And we have good recommendations about follow-up. And we have really detailed recommendations. If you have this disease, you need to follow up every so often. But one rule of thumb is even if you have really, really simple congenital heart disease, our recommendations are you should see an adult congenital heart disease doctor at least once, just to make sure we're not missing something. And every year we learn new things about this population. Every year we learn good things. Okay, this disease that we thought was horrible, people are doing better than we expected, but we're also learning this disease that seemed really mild there are things coming up down the road that we need to look out for. So it's important to get evaluated at least once. This was a study looking at pediatric cardiologists in the United States and in Europe, and kind of why they transition patients. This is a little older. So this is from 2009, and hopefully these numbers are even better. But even then, 26% of centers were not transferring care. But the majority of patients, the majority of centers were. And if you look at why they were transitioning here, let's see, okay. So the most common reason was here. They're transitioning over because the patient or the parents want to. But the second two, one is pregnancy. And so that's often a big one. I'm really comfortable taking care of this, 22-year-old, 23-year-old, 16-year-old, until they get pregnant, and suddenly it's time to go see the adult doctors. Or the next most common was they've developed some other disease, diabetes, hypertension, kidney disease, something that we see more in the adult world than in the peds world. And I would argue that this is the wrong time to transition. The time to transition was before those things happened. Because if you get pregnant, or if you develop some other disease, and then on top of that, you have to go to a whole new set of doctors who don't know you, it's not the right time to make that transition. It's better to get to know them earlier. This was a study that looked at, how people get lost to follow-up, prevalence and predictors of gaps in care. And you probably can't read this, but these are really big, good centers. These are centers that we all like to emulate, that we think they do a really good job with caring for adult congenital heart disease patients, and yet there were significant gaps in care. Patients with very mild disease, yeah, there's some gaps in care there, probably not as important. But in these moderate and severe complexity diseases, a lot of these patients had not been seen for years. And in fact, even in the severe study over here, like 8% of those patients hadn't been seen in 10 years. And these are patients with really, really bad complex congenital heart disease that need to be getting seen every 6 months, every year. Why weren't they being seen? So fairly predictable kinds of things. Number one, they felt fine. 23-year-old feels fine. Why should I go to the doctor? For the mild and moderate complexity ones, one of the most common was, I didn't know I needed to follow up. And we tend to think, okay, well, that's the patient being ignorant. But the reality is, we often tell them that. If you turn the clock back 20 years, a lot of patients were kind of told, you're cured. You don't need to follow up with anybody else. And that's not necessarily true. As you get into the moderate and severe complexity, financial reasons, insurance issues become more and more of an issue, and something we as doctors can do to kind of help think about these things early during the transition process so this isn't a problem. How do doctors feel about this? I think it's kind of important. This isn't a know the enemy kind of thing, but at least when we look at studies about transitioning from pediatric care over to adult care, internal medicine doctors, it makes them nervous. So this isn't just congenital heart disease. These are patients with cystic fibrosis, with sickle cell, with kind of congenital diseases where patients are living into adulthood now. And if you ask internal medicine doctors, what do you feel about these patients coming into your practice? They have a lot of concerns. And those concerns can kind of get lumped into two different things. Number one, do I know enough to take care of these patients? Am I competent to take care of these patients? And number two, do I have enough time to care for them? You're seeing a patient every 15 minutes in an internal medicine clinic. Am I going to be able to spend enough time with the patient to care for them appropriately? Am I going to be able to spend enough time to meet patient and parental expectations, which often, some of these patients are used to the doctor sitting in the room for an hour at a time. So it's important to understand those concerns from the internists here. So transition, it shouldn't be bad, but sometimes it is. So what can we do to try to make transition better? Unfortunately, we do not have a lot of data with this. Don't read that. The gist of it is, if you look at all the studies looking at what works for transition of care of patients, we don't have good studies. We don't have real data to base our recommendations on. So it just becomes kind of common sense recommendations. There is a study going on right now to try to evaluate some certain approaches to transition, and we do have some guidelines. We are not going to go through these slides that are very busy, but I think the most important thing is this starts early. This should start when the patients are 12 or 13, when they're starting to get into their teenage years, they're starting to mature, because it's not a 1-year process, it's not a 2-year process, it's a 5-6 year process of teaching that patient about their disease, getting the patient and the parents used to the fact that they're going to transition over, and kind of taking that patient from, I'm just going to sit there playing on the iPad while mom does all the talking, to I'm going to be in charge of my own care. So this was a fairly recent study looking at what protected patients from being lost to follow-up when it came to transition, and some things that we can do to help. So if the patient and the parents believe that specialized adult care is necessary, they're more likely to follow up. It makes sense. So we need to teach patients that. Poor health status makes sense too. The patients that are sicker are going to be more likely to come in. Attendance at pediatric appointments without the parents tended to be protective against being lost to follow-up. And that's hard. It's time. It eats into our time, that moment where you say, okay, I'd really like to talk to Johnny with you guys not in the room. It makes the parents nervous, because the truth of the matter is sometimes that is the sex, drugs, and rock and roll talk that make parents nervous. But it's not just that. It's also getting that patient used to talking to a doctor, allowing that patient to mature into a point where they're not just going to look at mom or dad and have them answer every question. So that's very helpful. And then finally, referring the patient from the pediatric cardiologist to a center. Don't just go find somewhere, here's who I recommend, here's how to set up an appointment. In fact, let me help you set up an appointment to see that doctor. And here are my recommendations, kind of general. This should start around age 12. And starting around age 12 sometimes just means, someday I'm not, as the pediatric cardiologist, someday I'm not going to be your doctor anymore. And that's a good thing, because it means you're growing up. And here's how we work that transition process, and just getting the family and the patient used to that, and then slowly kind of working them up over the next 5-6 years to the point where the patient knows their disease, knows why they're on medicines, knows why they need to follow up long term. The adolescent needs to engage in their own care. We need to educate adolescents about their disease and about reproductive issues. Exercise, we need to educate them about exercise, because it's pretty rare now that we tell patients that they can't exercise. Discuss limitations that could affect career choices, and finally discuss future insurance needs, because this can be a big factor in gaps of care. The patient needs a medical home, whether it's your pediatric cardiologist or your adult congenital heart disease doctor. You do not want us treating your strep throat. You need a primary care doctor to manage all that, but an adult congenital heart disease doctor should guide cardiovascular care for these patients, not a general cardiologist.